My initial want for the program was to gain exposure in the patient-centered area and also to understand workthroughs of the clinical trial process. Being in the lab in my previous experience, we don't really get to see the patient-centered side of it, so I felt like the ACT program was great exposure into that aspect. I was looking for the hands-on experience through the ACT program without having those pre-required degrees. What stood out for me in the program is the immersive aspect. We've gotten to do hands-on simulations. We've gotten to do OSCE evaluations with simulated patients so we can see firsthand how encounters would go in the clinical space, and we've also had great lecture to reinforce our overall knowledge of what we'll be seeing in the actual field. This program honestly has taught me how to deal with difficult patients, how to deal with easy patients, and how to handle unforeseen circumstances overall.